Hey guys, are you one of the average Americans who consumes up to 24 teaspoons of sugar a day? Maybe directly or indirectly, that not even something you may be aware of. Well, this spinal workshop is intended for you. Hi, my name is Dr. Ryan Weaver here at Apex Spine and Performance. Today we're going to begin by going over our spinal workshop series. Tonight's topic is sugar. We're going to talk about how it ends up in our food, what are some alternatives to that, and what are the most common ones that it may be in that you may not even have an idea that it's in there. So we do these spinal workshops again every Tuesday evening. We have seen our patients improve faster by tuning into these and making healthier lifestyle decisions. What we know is that patients who follow these guidelines and other things that we ask them to do outside of the office, because the lifestyle choices factor in up to 60% of patients healing in our office, that helps them make a lifestyle change. So let's begin by addressing sugar. The average American adult male consumes 24 teaspoons. That's around 384 calories a day with sugar. That is added sugar, by the way. So when you look at a label, that is one thing that we talk about. Looking at those carbohydrates, seeing is it added sugar, is it natural sugar, is it in there, how is it in there, is it fiber, the carbohydrates, what all are those made of? So the average American consumes 17 teaspoons of added sugar, most common soda and energy drinks. To round out some of the other top 5 and top 10, baked goods, candies, yogurts and granolas. Again, added sugar. When you look and factor that in for an entire year, that is 57 pounds of added sugar per year. So, things that you need to know about sugar. Number 1, it causes inflammation within the body. Number 2, most of us are not active enough in America to burn off all of that excess added sugar. The other thing, and maybe you know this, is you get a huge spike of energy and then you immediately crash, anywhere from 30 to 60 minutes after consuming that. Now, one of the snacks that we'll talk about, yes, fruit, but what to pair those things with so you have sustained energy long term. Problems with inflammation. Well, most commonly we're going to talk about type 2 diabetes, which is a huge issue in our area, in our country. Cardiovascular disease comes along with that, fatty liver disease as well. With diabetes, we see nerve damage, neuropathies, vision loss, clogged veins and arteries, amputation and kidney failure. None of that sounds pleasant at all. Overall inflammation, I stated that. How about the way that sugar affects our brain? Again, dealing with the central nervous system, which is what we're dealing with here in our spine. Sugar stimulates dopamine. What that is going to be is your feel-good hormone in your body. That chemical triggers sugar cravings and can affect your mood. So how addicting is that? Other issues to the heart, to the liver, cirrhosis, joints, inflammation, arthritis, that's just going to compound and make all of those things worse. Excess carbohydrates, excess sugars and added sugars, nothing there is good. It's going to create a lot of oxidative stress. So again, when you look at, well, why should we be taking antioxidants? Oxidative stress plays a role in that. Those are the things that we need to help combat against those. Hidden sugars. Probably when you go down through that ingredient list and you see what the specific things are, you're going to see a lot of things ending in ose. So dextrose, fructose, glucose, lactose, maltose, sucralose, all of these things, all of these things are sugars. Cane sugar, corn syrup, brown rice syrup, barley malt, dextrin, those are just to name a few. These are the things that we have to watch out for. And when you start peeling back and diving into the ingredients and the sugars and everything that's in there, there's a lot of it. A 2014 JAMA internal medicine study found the association of high sugar diet and dying from heart disease. this was over a 15-year study, people who got 17 to 21% of their calories from added sugar had a 38% increase and a higher risk of dying from cardiovascular disease compared to those who only consumed 8% of the added sugar. So, what you need to know. Number one, try to avoid added sugar at all costs. Again, I'm not telling you to be perfect. I love cheesecake. Occasionally that'll happen. But when we look at that long term, we need to avoid just added sugar. So I get the question, what about fruits? Those have sugars in it? Yes, they do. So with those, be careful of when you eat them. You heard me reference a snack earlier. If you're going to have, something you need sugary, some fruit, and then pair that with a protein or a fat. An orange or an apple and almonds. That will help sustain the energy so it's not such a spike and then you crash. Fatigue's gone, or fatigue happens, mental clarity happens, or not mental clarity, excuse me, the lack of mental clarity, all of those things will start to be compromised. So, alternatives. One of these I've recently started using myself more so, and the second one we've always preached, especially for allergies here. So the number one, monk fruit. That is one I've personally tried. I like that. You can find it. There is a energy drink on the market that you even see that they use that instead. Again, I'm not telling you to be perfect, but try to watch, the less evils, the better. So monk fruit. Raw honey, another one. Again, that's the one we reference with honey and allergies in your area. So checking those things out. The next two, maple syrup. Okay, again, if you're going to have something that you want sweet or something like that, I would always prefer something that is a natural substance, something like that. And last on the list there is stevia. Again, even stevia, you hear some goods and bads about that, but you try to pick a healthier alternative. So, thank you for tuning into the Spinal Workshop. I hope this at least makes you question and start looking at things. Some of the ones that I was shocked about were the granola, yogurt, and the other one there, off the top of my head, I'm blanking on what it was, peanut butter. That was it. But look at everything that you consume, and that could be a study that you do tonight. Just take a handful of things in your house. If you have cereals, that's another big one. And look and see how much added sugar is actually in there. And then think about how much of that you consume in a day, in a week, in a month, and in a year, and that adds up. So, I hope that this information was informative for you. I hope this makes you think twice about where all the sugars and those excess calories are coming from, because it can happen just like that. So, thank you guys for tuning in for tonight's workshop. We'll look forward to seeing you next week at our next Spinal Workshop. Take care.